Well, I think the number one thing that you need to understand is that you need to be your own advocate. I think we have this gut instinct that we just want to trust when people say, you know, something is a certain way. And the reality is, when we deal with an insurance company, we're dealing with a lot of different people, we're dealing with a lot of different documents, and sometimes things that we hear conflict with what we've been told in the past.
So in regards to advocating for the patient and what questions they should be asking, if a patient is coming in diagnosed with a specific disease category, what our team and what our case managers and myself as well, what we normally try to ask, has your doctor talked to you about this? Has your doctor talked to you about a clinical trial? Has your doctor talked about any other testings that should have been done? Usually by then the questions start kind of coming from the patients. Well, what should I be asking them? And then usually we always says, well, why don't we make a conference call to your doctor's office? Why don't we see if I can get engaged and see if we can have maybe a care team meeting or something else that you can discuss more with your doctor, and I will give you a list of questions of maybe what you should start asking from that point.
I contact the medical facilities with them to see what type of assistance is available. And that educates the patients, that teaches them how to be their own advocate. So in the future, they may not even need me. And if they do, I'm still here. And I'll let them know, pay attention to how this is done. Because if you get additional bills, you know, you can always call on your own, but at any point, if you need me to be on the line with you, I'm here for you.
What our approval specialists and our call counselors, what they try and do is ease the situation, letting them know that their access to assistance is very easy. We don't make them feel as if they are begging or asking for something that should not belong to, that does not rightfully belong to them. And we try and make the process as easy and as quickly as we can.
Sometimes I don't think anybody really knows that if you get a bill in the mail from a certain facility, I know on the bottom of most bills it does say please call for billing inquiries for additional questions, but I think sometimes patients are scared to call. They're afraid to admit that they can't afford this, they don't know what to do, or maybe they just don't have any money to even offer up front to even pay on that bill. One of the things for our case managers is really kind of just being that empowerment for them and making the calls with the patients so that they can see it. I always call it's almost kind of like having a cheerleader in your pocket.
When people are newly diagnosed and they reach out to us, one of the things we try to do is give them the information they need so that they can be proactive on their own cases and help talk to their medical providers about what their out-of-pocket expenses are going to be. And that's often going to the financial counselor at the doctor's office or a billing person. They can break down exactly what your insurance is going to pay and what your out-of-pocket expenses will be.
As a case manager, I believe the most important item is teaching self-advocacy almost as a patient. Even if you don't have any kind of illness, it is still very important to understand healthcare, the terminology, and just benefits in general in order to continue care for individuals that may have a diagnosis. It's just so important to just try to educate yourself a little bit.
One of the things that people can do is to be their own advocate is to actually, we have some publications on how to talk to your provider. Just some of the basic questions that you need to ask is, what is the treatment? How much is it going to cost? How long is it going to last?
I think what makes PAF unique in the service that we provide is our commitment to sustained assistance, one patient at a time. We don't just educate and we don't just navigate or inform. We actually meet patients where they are today, and we work side by side on their behalf to make sure that the practical barriers that are preventing them from accessing care are removed.